All right, Dr. Vanderhoff, I believe we have everyone in the room. I will turn it over to you. Thank you, sir.
Well, thank you very much, and good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health, and I appreciate you joining me today. For some time, I have said I believe it is a matter of when, not if, the Pfizer vaccine receives full FDA approval. Now that day has come. Full approval of this safe, effective COVID-19 vaccine can give Ohioans an added layer of confidence when choosing to be vaccinated. The Pfizer COVID-19 vaccine was built upon decades of mRNA vaccine research and was thoroughly evaluated and tested in one of the largest vaccine clinical trials in history. The world's most comprehensive vaccine safety monitoring system has closely observed the more than 200 million doses that have been administered in the United States, including more than 6 million doses administered right here in Ohio. This action by the FDA validates the confidence of so many physicians, scientists, and public health experts in the safety and efficacy of the Pfizer COVID-19 vaccine. For any Ohioan who has been waiting to receive the vaccine until full approval is granted, today is the day. Pfizer vaccines are readily available at providers across the state, and COVID-19 vaccines are our best protection against the virus. Although the FDA approval is good news, our Delta wave of COVID-19 continues to drive our numbers ever higher. Our cases per 100,000 averaged over a 2-week period, which just a month ago were less than 50, are rapidly approaching 300. Not surprisingly, in just a month, our adult hospitals have seen their COVID hospitalizations jump almost 5 times higher, creating real stress and challenging their ability to maintain some services. Sadly, in addition, more Ohio children are now landing in the hospital due to an unexpected summer surge of respiratory illnesses. And with COVID-19 on the rise, we may be approaching a perilous situation. At this time, the Ohio Children's Hospital Association has reported that they are seeing a wave of respiratory viruses and illnesses typically seen in winter rather than summer, namely rhinovirus, parainfluenza virus, and respiratory syncytial virus, better known as RSV, all on top of COVID-19. Rhinoviruses are the leading cause of the common cold, and they can trigger asthma attacks and have been linked to sinus and ear infections. Parainfluenza virus, not to be confused with the flu, causes upper and lower respiratory illnesses, particularly in infants and young children, older adults, and people with weakened immune systems. It can also cause croup, bronchitis, bronchiolitis, and pneumonia. Finally, there's RSV. In older children and adults, RSV mostly causes mild cold-like symptoms. But in very young children with smaller airways, such as toddlers and babies, RSV can be far more serious, causing trouble breathing, pneumonia, and bronchiolitis. RSV infections typically occur in late fall, winter, and early spring. This unseasonably early increase in RSV, coupled with rising pediatric cases of COVID-19, is a recipe for disaster. Although, thankfully, our children's hospitals are not yet at critical capacity levels, we're very concerned. Emergency departments, ICUs, and hospitalization rates are at levels more comparable to what we experience in the winter. It's not winter, it's August, summer, and therefore it's likely that the worst is ahead of us. On top of this wave of winter pediatric respiratory viruses, based on the pattern seen elsewhere, we can expect further increases in COVID-19 case rates driven by the highly contagious, dangerous Delta variant. And it's not really an issue of children being at risk for COVID or one of these respiratory illnesses. In fact, it's not uncommon for children to come down with 2 respiratory illnesses at once. Nationally, there have already been reports of children simultaneously developing RSV and COVID-19. And while not enough is yet known about the impact of having both viruses together and whether having COVID could worsen the course of RSV, I firmly believe that most parents of young children don't want to find that out and would prefer to take preventive measures to protect their children. So as we're sending children back to the classroom and into extracurricular activities, we have to be cognizant of how we can keep our children safe and healthy. The very best way to prevent COVID-19 is vaccination. Vaccination is simply the best way to protect eligible youth from getting COVID-19. And for younger children not currently eligible for the vaccine, the adults and teens around them can substantially insulate them by choosing to be vaccinated. Thankfully, we continue to see eligible Ohioans choosing vaccination, and we're coming very close to 60% of those 12 and older having started their vaccines. Another way to protect children, of course, is with masks. Last year, we saw remarkably low numbers of other respiratory illnesses, including RSV and influenza. And as you'll recall, we were all wearing masks. As we've discussed before, mask wearing significantly reduces the risk of spreading respiratory viruses from one person to the next. When you're infected with COVID-19, many times unknowingly, you can pass the virus to someone else simply by talking. That's because COVID-19 spreads from person to person by way of respiratory droplets released when an infected person sneezes, coughs, or talks. When worn properly, the mask blocks your respiratory droplets from reaching another person. And it isn't just COVID-19. Other respiratory illnesses are spread by droplets as well. We saw the impact of masking this last year when masks helped limit the spread of COVID-19, along with other respiratory illnesses. There were simply far fewer cases of respiratory viruses like flu, RSV, and colds. But when the masks came off, people started getting sick again. Now, as we see these abnormally high numbers of summer RSV cases among children, just as we're encountering a tremendous Delta wave of COVID-19, we continue to urge caution. But there are steps we can all take today. First, choose to be vaccinated from COVID-19. This flu season, get your flu shot. Wear a mask. Wash your hands. Practice social distancing. Do it to protect yourselves, to protect the children around you, and to protect the babies too young to protect themselves, who are vulnerable to severe cases of RSV. Now, joining me today are two highly respected pediatric experts to talk about what we're currently seeing in Ohio's children's hospitals and about what we can do to protect Ohio's children. First, I'm joined again by Dr. Michael Forbes, a pediatric intensive care specialist at Akron Children's Hospital and interim chair of the hospital's Department of Pediatrics. So first, let me turn to a question, Dr. Forbes, about RSV. Can you tell us a little more about the virus and who is most at risk?
Sure. Thanks again for having me. RSV stands for respiratory syncytial virus. That middle word there, syncytial, is a mouthful, but really speaks to the unique way that RSV injures the lung. And so we know that RSV is a common, highly contagious seasonal virus, as you mentioned earlier, that typically shows up with, what I consider the gang of viruses every winter: flu, paraflu, rhino, RSV. They're all together in the flu season, or in the flu and cold season. In March of this year, the CDC issued an advisory that we should all be on the lookout for what they saw as an uptick in RSV. And the rationale behind that really was they were seeing it nationally. And we know that this year's RSV or last year's RSV tends to give you some degree of background immunity to this year's RSV. And as you alluded to earlier, we didn't have much RSV last year or flu. And I really want to point out the fact that we have a flu vaccine, and we had very, very little flu. We don't think the reduction in flu is just a vaccine. There's no RSV vaccine, and we almost eliminated RSV in many hospitals last year. And so it wasn't the vaccine, it was the masking. And so it's really important. And I think it's kind of a, not a study, but I think a really important observation that we virtually eliminated RSV just by masking and distancing and keeping our hands clean last year. So really important. You ask who is also at risk. Every child, pretty much every child's infected by the age of 2. So we've all had RSV, but there's a specific group in particular, high-risk group. Babies born preterm and babies born with certain heart and lung conditions are also uniquely vulnerable to severe RSV disease.
Well, thank you, Dr. Forbes. You mentioned that RSV is particularly dangerous for those young children. What are the concerns for families who may have young children in daycare centers or schools, particularly for those who may have those less than 2 years of age? What safeguards would you suggest they consider?
Sure. For infants and toddlers, if you have siblings who are in daycare, if those kids are in daycare, or if they're siblings who are in school, it's important to make sure that you continue to do what you've been doing throughout this pandemic. That is, wash your hands, physically distance, and wear a mask. You can also talk to your healthcare provider to find out if your child at home is at high risk. Again, preterm babies, kids with certain heart and lung conditions, to find out what you can do from a preventative standpoint to protect those children. In the meantime, again, continuing to use the toolkit, right, the pandemic toolkit, as far as distancing, hand washing, wearing that mask, and really choosing to wear that mask whenever possible to make sure that we're not continuing to spread RSV and any of the other viruses.
Dr. Forbes, as I reflect on my clinical career, I simply can't remember a summer with RSV levels anywhere near what we're seeing now. Can you tell us a little bit more about why you think we're encountering this wave of RSV now in what is really the hottest part of summer?
Yeah, great question. I don't think we really know, but I think we can speculate. We know that from year to year, last RSV season does create some degree of background immunity for the next season. We also know, as I mentioned earlier, that the masking and all of the toolkit actions that we took really works. And so what we have this year are a group of children who have no background immunity. And when I refer to background immunity, among children and among adults, because RSV affects adults as well. And so you have a group of a vulnerable population. And I think what we saw here is also what was reported in Australia is once we lifted our restraints and people began to interact again, not only and folks were vaccinated against COVID. And so we didn't see certainly a spike in COVID right away, but we saw what was in the background, and that is RSV. And so now we have the RSV spike in the middle of the summer, which is unusual. We're usually less than 1% positivity at this time of year. We've been as high as 40% in Akron and around the state. So it's very, very unusual, but we are dealing with it. And honestly, the good news is we're smarter than ever around this. And I think we've learned that masks really, really work. I mean, it was controversial earlier in the pandemic. I think the controversy is over. Masks are highly effective, and as well as the rest of the toolkit, of course.
Thank you, Dr. Forbes. Next, I'm going to turn to Dr. Manning Courtney. Dr. Manning is the Chief of Staff at Cincinnati Children's Hospital Medical Center. Dr. Manning, I know that pediatric experts like yourself have been closely following the information that we're seeing coming out of other areas of the world and out of our southern states. What are you hearing regarding Delta and COVID-19, and what could that mean for us right here in Ohio?
Sure. Thanks, Dr. Vanderhoff, and hello, everyone. I think you've all heard this. We've been paying very close attention to our southern neighbors and seeing the rising numbers of children with COVID. Not just more children with COVID, but children who are getting sicker with COVID. And we don't really have to look much further than Tennessee. We certainly look at Alabama, Florida, Tennessee, and even Kentucky. We're seeing those numbers increase. Last week on a phone call with our Ohio Children's Hospital Association partners, where we share information, it was clear that the movement of positive COVID children seemed to be going south to north. And so here in Cincinnati, we were feeling even more, higher numbers of children that were impacted compared to some of our neighbors to the north within the state. And so we're concerned. We're paying very close attention, and we're experiencing that here in Cincinnati.
Well, of course, these respiratory viruses are all happening together at the same time, COVID with RSV and some of these others. And of course, that has an impact on our pediatric emergency rooms and our pediatric intensive care units. If we continue to see this kind of upward trend in COVID-19, along with these other respiratory illnesses, what impact could that have on our pediatric hospitals statewide?
Well, the biggest impact that it would have is that we would be dealing with a higher volume of sick children. And that higher volume affects everything that we do. It affects the flow of our patients through our system. So first, patients might back up in the emergency room. And we hate when that happens. We can't stand when somebody is waiting hours and hours for a bed, or they're in a room for a long period of time waiting to be cared for. The next thing that can happen is that our hospital beds themselves become full, and that affects other patients that we can take into our system, particularly within our intensive care units. When our intensive care units become full, we get very concerned about how we will handle our sickest patients, how we will receive transfers from other areas, or how we will even handle things that we call elective surgeries or elective procedures, but they're not really elective. These are children who need surgeries for cancer, for tumors, for fractures, or for other critical conditions, but they're not urgent. And so we worry that we have to delay care because the volume of children that need us is so great that we have to make some hard decisions about what we can and cannot do. And we just don't want to be there. We want to care for everybody and give them the care that they need.
Thank you. We know people are tired of dealing with COVID-19. I think people were hoping that we were finally done with having to deal with the masks, and that we could get life back to what we remember before COVID-19. But now with the highly contagious Delta variant, it's really not the time for us to put those safety measures behind us, particularly for our young children who can't get the COVID-19 vaccines. With the spread of RSV and in the face of this COVID Delta wave, what recommendations would you offer as a pediatrician to families of Ohio?
To Ohio families, I would say, as you've already said and Dr. Forbes shared, if you can get vaccinated, please get vaccinated. A vaccine is like a shield. I've been thinking about a vaccine like a shield. And the more of us that have shields, the safer we all are. No shield is 100%. And so in addition to getting vaccinated, wearing a mask when you're indoors, including in schools, using hand hygiene, and really thinking twice about those gatherings that seem to place us at risk because we don't know everybody's vaccination or disease status. But really the way I've been thinking about it is this. We are charged with caring for the sickest children in Ohio, children with cancer, children with organ transplants, children with genetic disorders, children with all kinds of conditions that we're uniquely positioned to care for. And we can usually do that without any help. We don't ask you for help. We're asking for your help. We need your help so that we can continue to do the things that we're uniquely able to do. And that help comes in the form of getting vaccinated, wearing masks indoors, including in schools, using hand hygiene and social distancing.
Thank you so much, Dr. Manning. Ohio's Delta-driven wave of COVID-19 continues to drive cases and hospitalizations ever higher. And with Ohio's children's hospitals already seeing high levels of respiratory illness in line with what they would normally see in the winter, plus increasing cases of pediatric COVID-19, we must all do what we can to protect Ohio's children. Now, vaccines remain our best protection against COVID-19. And today, with the announcement by the FDA of their full approval of our COVID-19 vaccine from Pfizer, I think those who had been waiting for that extra sign of approval can really rest assured and can get in line for the vaccine. But for children who are not able yet to receive the vaccine, the layered prevention measures we have become so familiar with, masking, washing our hands, maximizing distance between ourselves and others, ensuring good ventilation, these remain vital to help keep us safe as we continue to battle against COVID-19. And now, Alicia, I think we can take questions.
Thank you, Dr. Vanderhoff. Our first question comes from Danny Eldredge with Hannah News.
Hello, Director and doctors. Thanks for taking your time today. So my question's about staffing at these hospitals. I'm hearing that there's been issues with having enough staffing. People are being offered a lot more overtime, and also the fact that hospitals could have enough beds, but if you don't have the staff to take care of people, I mean, that's obviously a huge issue. So can you just talk a little bit about that and what the hospitals are doing and what the state's doing to try to address that issue?
Well, I think for that, I'll turn to my two colleagues. Dr. Forbes, I know your time is limited. Maybe you could start and then we'll turn to Dr. Manning.
Sure. Thank you very much. And I appreciate the question. I think that it's nice to hear that the folks out there recognize the hard work that's been going on for over a year now, year and a half within all of our hospitals. I read a statistic recently that over 500,000 people left the healthcare sector altogether last year. And that really is, it's telling. At a time when we need more people, we actually have less people. And so our organization is committed at the executive leadership level. I know most of the hospitals are thinking along the same lines. We have to take care of our people because our people take care of our patients. And so we don't want care delay that Dr. Manning alluded to, care delay and care failure and even patient harm. We take care of children who can't even climb a flight of stairs, and they're old enough to do that. And that's because of their condition, their state, and that's what we do. And so we know that, and we're dedicated to those kids and keeping our promises to those children and their families. And so we are looking at every opportunity to recruit as fiercely as we can. We are very committed to retaining every single member of our staff. We can't lose another nurse, respiratory therapist, medical assistant. This is all hands on deck for us. And you alluded to at the top of our meeting today that it likely will get worse. We want folks to join our groups, join our hospitals, and help us in the fight to stay on top of this. And in addition to the recruiting and retention efforts, I want to put another plug out there. Please choose to get vaccinated if you're eligible. Please choose to wear your mask. Both of those are so effective so that if we don't get more people, we can at least take care of the children who come before us for help. So thanks again for the opportunity.
Dr. Manning?
Well, the only thing I could possibly add to everything that Dr. Forbes said would be that it's so dramatically different from last year. I've said this a number of times. Last year, we had, everybody was wearing a mask, and so we had far fewer sick children, and we had better staffing. And as you heard Dr. Forbes share, we're all experiencing a pretty significant exodus of people from healthcare for all kinds of reasons. It's been a hard year and a half. And some people have just said, you know, I can't do this anymore. So we're all recruiting aggressively. We're adjusting pay and referral sources and doing everything we can to hang on to those very critical frontline providers, nurses, MAs, respiratory therapists. Every person plays such a critical role in the care of children. And the part that you can do, the way you can help us, as I already said, is to get your vaccine, wear your mask, wear masks in schools, do everything you can to keep the children in your lives from getting sick, because that helps mitigate the staffing challenges that we all have.
Thank you, doctors. Our next question comes from Josh Rultenberg with Spectrum News.
Hi, Dr. Vanderhoff. I just wanted you to clarify something before I ask a question. Earlier in the press conference, I believe you said the case number per 100,000 over a 2-week period. Did you say that it was approaching 300 or it's at 300?
Yeah, approaching. So we're seeing those numbers rise. It's really been quite dramatic. As you know, we went back to the beginning of July. We were as low as a little bit north of 17. Now, as you look at our numbers, we're between 250, 300, and I fully anticipate we'll go north of 300 cases per 100,000. And remember, the thresholds that have traditionally been used have 100 cases per 100,000 as an indicator of a very high rate of spread of the virus. So to be at 300 or to be at 250 or 200 means you've got a lot of spread all across the state. And we have not seen numbers like this since our last winter. So these numbers look like what we were seeing in February.
So with that said, when Governor Mike DeWine removed the mask mandates, originally he had said he wanted that below 50 per 100,000. He, of course, did it before, but then when June 2nd came around, it was close to that. So my question to you is, should Governor Mike DeWine reissue a mask mandate or even have a vaccine requirement and let the state legislature consider keeping it in place afterwards? And why should kids go back to school in person if these mandates are not made, considering how dangerous things are getting?
Yeah, so a number of things there are a number of questions there. So first of all, let's remember that the most effective thing that we can do for those of us who are eligible to be vaccinated is to receive a vaccine. And from the beginning, we've made it clear at the state level that we see vaccination as being something that's an important choice for the people of Ohio to make. But you know, the good news is we are actually seeing and have seen now for a couple of weeks more and more Ohioans going in and getting the vaccine. That's why I pointed to that very, very hopeful statistic that it appears to me that we're on the cusp of being able to cross the 60% threshold for people 12 plus actually having begun the vaccination process. So I do think that Ohioans are hearing this message and are taking up the challenge to receive vaccines. Today's announcement by the FDA of full approval for the Pfizer COVID-19 vaccine, I think is just one more reassurance for people who may have been somewhat on the fence about whether this was the right time for them to receive vaccination. So I'm really encouraged by the progress that we're beginning to see there. You know, in terms of the safety measures that we can undertake as our children return to school, we already know from experience here in the state that we can safely return to the school year. And we can do that by using the layered safety approaches plus now vaccination to assure that our students have a good year and without disruption to their academics or their extracurriculars. But that only happens when people take advantage of both the opportunity, if they're eligible, to get vaccinated and wear masks and practice appropriate distancing, hand hygiene, et cetera. So there is no reason for our students not to be returning to school. There's every reason for us to resume in-person education. And at the end of the day, no mandate is going to be able to have an impact without the people of Ohio being behind the measures. And education about what's happening, education about what people can do remains probably our most effective way of helping to help the people of Ohio get ahead of this wave.
Thank you, Dr. Vanderhoff. Our next question is from Allison Walker with WKEF in Dayton.
Hello, everyone. Thanks so much for taking the time today. Dr. Vanderhoff, does FDA approval of Pfizer mean that it's likely that Pfizer will be approved for children under 12 years old sooner than expected?
Well, I can tell you, and I shared this in my opening comments, and I've said it before, I think it has come as no surprise to the medical community that the Pfizer vaccine received full FDA approval. When we look at the sheer volume of case information that we have, the sheer volume of the safety record that we have for this vaccine as well as our other vaccines, it's clear that the vaccines which we have access to have been thoroughly and very completely studied, that they are safe, that they are effective, and that we understand very well what their limited side effect profile is. So I fully anticipate that the younger age bracket will follow behind the 16 up age bracket in receiving full approval from the FDA. But I think that it's to the FDA's credit that they continue to move through a thoughtful, deliberate, and careful process of completing all the steps that they've committed to in their approval process. So yes, I am very confident. I know, Dr. Manning-Courtney, you've been involved with a team that has played an important role in some of the research around the vaccine. Would you want to add to that?
Sure, I would simply add that we've been so fortunate that here in Ohio, we've been involved in these trials here at Cincinnati Children's. We've had local children participate in these trials, and we are very optimistic that an approval for children between 5 and 12 will be coming in the very near future.
Thank you. Our next question is from Joe Ingles with Ohio Public Radio and Television.
Hello, Dr. Vanderhoff and the other doctors. My question is, we've got these kids going back to school, and we know that many of them, the younger ones, cannot be vaccinated. And a lot of these kids, if they are around someone who has COVID, they may be taking these at-home antigen COVID tests, which it's up to the parent, it's up to the person administering that test to be honest and to submit those results. There is some anecdotal evidence that maybe kids are being sent to school with positive COVID tests, not taking long enough to quarantine or isolate. What can you say about, what advice can you give people about how to handle that situation?
Well, of course, the reason, thank you for that very good question. You know, the reason that a person should be tested is both to identify whether or not they are infected with COVID-19 and to ensure that they are not inadvertently posing a risk to other people. While, of course, there's always a risk that some individuals will not take the situation seriously. I just don't think that's true for the vast majority of people in the state of Ohio. You know, with all of these issues, whether it is an issue of being tested, whether it is an issue of receiving vaccine, of wearing a mask, there is a level of personal responsibility that all of us have to the community, to the people we care about. And what I would ask people to remember is that this is about, yes, your health and your family's health, but it's also about the health and safety of people you care about, your friends, your neighbors, your coworkers, your other family members who live outside of your home, including some family members who may be of advanced age or have other medical conditions that place them at greater risk related to COVID-19. So at the end of the day, we all have to work together to overcome this COVID-19 Delta wave. And that's the only way that we'll be successful.
Thank you, Dr. Vanderhoff. Our next question is from John London with WLWT News 5.
Thanks for all you've said so far. I wanted to ask Dr. Manning, and maybe Dr. Vanderhoff might weigh in as well. You all emphasize vaccination, which you have been doing consistently throughout the pandemic. The reality that I see, and correct me if I'm wrong, but of the 12 to 17 age group, the percentage that have been vaccinated so far is relatively low, I guess you would say, somewhere in the neighborhood of 30%, I believe. We got schools back. And so two things with the RSV being what you say it is, Dr. Manning, what's the outlook here for the next few months? And then for both of you, why isn't, I know you mentioned social distancing, but it seems like it's one of the safest things. Do you think it's being emphasized enough? Because ever since the health orders were lifted, that 6 foot space, from my observation, has really shrunk out in society.
So I'll take
Go
that.
ahead. You start, Dr. Manning.
I'll start. So you are correct. The vaccination rates in the 12 to 17-year-olds could be better. They're in that 35% range. And we are doing lots of things on our campus to make it easier for children in that age range to get vaccinated, whether it's through our clinics, through our primary care clinics, and our community physicians are doing an amazing job offering vaccination to their patient populations. I think there is still some hesitancy amongst families in that age range, but as you recognize, it's critical because I'm not even thinking out a few months. I'm thinking out a few weeks right now, frankly, with RSV and with COVID. And at the rate that things are rising with kids, between RSV and COVID, we have to do everything in our power right now to get through the next few weeks. And then I can worry about the next few months. And that means getting vaccinated, wearing a mask in school, and to your second point, being better and more vigilant about social distancing. I do think we've learned that social distances can probably be in that 3 to 6 foot range, but we're certainly seeing lots of gatherings and lots of activities where people are in quite close contact without masks. And this is really the time to revisit those types of activities. Ask yourself, do we have to go to that party? Do we have to go to that event? If we do, should we wear a mask? Because there's, just like a year ago, we talked about these types of events where COVID could spread very quickly. Delta does that 3 times more effectively than the variants that we were dealing with last year.
Yes, thank you. And I think what I would add to Dr. Manning's comments is that I think for too many Ohioans and too many people, frankly, across the nation, a notion developed that COVID-19 was just not something that impacted people less than 18 years of age, that this was a disease of older people. And what we've learned since the beginning of the pandemic is that's just not true. Not only, and we've outlined this in other press conferences, can otherwise healthy children develop very, very severe consequences, including the multi-system inflammatory syndrome of children that places them in the intensive care unit and causes severe inflammation of many body organs. Not only that, but now, as we're sharing today, we're actually seeing that children can have COVID-19 in combination with other viruses at the same time. And there's real concern as we're seeing more and more children landing in the hospital with these other respiratory illnesses that COVID-19 may actually be putting them in a less advantageous position. It may actually be complicating their other respiratory illnesses. So this is not the time to think that just because one is a child or less than 18 years of age or a young adult, that COVID-19 is not something that matters to you. It does. And that there are personal reasons for you to get vaccinated, not to mention the fact that not getting vaccinated really leaves you at risk for some avoidable disruptions to your own life, whether it's participating in sports or other extracurriculars, or of course your academic activities. So I think now is a very important time for all the parents of our vaccine eligible children to take them in and get them vaccinated.
Thank you, Dr. Vanderhoff. Our next question is from Mariel Carbone with WCPO.
Good morning or good afternoon, I guess. Now, doctors, this is either one of you could answer. Both of you guys had mentioned that with today's Pfizer approval announcement that you do expect that soon we'll see a vaccine for that 5 to 12 age group. What is soon? Is that a month? Is that the end of the year, January? What does that time frame look like? And is there any indication if it would be full approval for that age group or another emergency use authorization for 5 to 12?
This is Dr. Vanderhoff. I'll say that for the 5 to 12-year-old age bracket, the FDA has already signaled that their initial step with that will be the same as it has been with every new age bracket that has been added. They will likely begin with emergency use authorization and have that followed after a period of time with the process that results in full approval. And I just want to emphasize, and hopefully the approval today of the vaccine for ages 16 and older proves this point. But the process of full approval really has a lot to do with being able to demonstrate that the vaccine, in terms of issues that involve things like manufacturing, is in a position where it can essentially go into the standard state of approval. Emergency use authorization still represents an approval for utilization, an authorization for utilization that reflects robust safety and efficacy review by the medical and scientific community. And I think that parents should have a very high degree of confidence when that authorization comes. Dr. Manning, what would you add as somebody whose institution is involved in the research?
I think you laid out the timeline and the standard expectation perfectly. And as I said before, we've had so many willing participants in these studies, and that data accumulates to allow for both the EUA and then finally the full approval once that last study dose has been given. I think it's 6 months out is the required timeline before full approval. So we can't wait. We will be so excited here at Cincinnati Children's when we can start offering vaccine to younger children.
Thank you, doctors. Our next question is from Jon Reed with Gong.
Thank you, doctors. Can you talk a little bit about the symptoms of RSV and these other illnesses as compared to COVID-19, and do they all spread basically the same way?
Thank you. I'll let Dr. Manning, as a pediatrician, field that question.
So interestingly, we've had a lot of experience with RSV, and so we're very familiar with the symptoms of RSV: cough, congestion, wheezing, particularly problematic in babies under 2, whose airways are smaller. They can have a very specific clinical presentation, so much so that our pediatricians here on staff and faculty and in training become very familiar very quickly with RSV and the lung disease that it causes, which we refer to as bronchiolitis. In contrast, COVID can cover a wide range of symptoms, and we've learned this over the past year. You'll all remember the very beginning, we thought, well, fever, that's a presenting symptom. And then we realized, well, no, it's fever plus some cough and congestion. And then it kind of morphed into, well, sore throat and a sinus infection. And there have been people who present with GI issues with COVID. So COVID is a very expansive set of symptoms and almost defies a good, very specific clinical presentation, whereas RSV, very familiar with it. We've seen it for a long time. So our clinicians feel pretty adept at distinguishing and identifying, here's RSV, here's COVID, and here's when we have to worry about one versus the other.
Thank you, Dr. Manning. Our next question is from Jessie Balmert with USA Today Network Ohio Bureau.
Hi, thank you. My question is, do you have a breakdown of what percentage of cases are COVID-19 versus RSV versus rhinovirus? What is leading to the capacity issues? Do you have a breakdown of that?
Just for clarity, you're referring to what's driving this wave of pediatric respiratory admissions to our hospitals?
Yeah, that would be great. Yes. Or if you have a way of saying 20% of the beds are being taken up by RSV patients, or something like that.
Yeah, what I can offer at a high level is that we're hearing from all of our pediatric hospitals that this unprecedented summer wave of these common respiratory viruses led by respiratory syncytial virus or RSV is impacting all of our children's hospitals. And that on top of that, they are seeing some increase in the number of COVID-19 cases. And so when you put it together, it really creates almost a perfect storm of activity at a time when our children's hospitals normally this time of year see very light volume of respiratory illnesses. And so we're not typically geared up for that in August. But in terms of more particulars, Dr. Manning, is there anything more you could share?
You know, I can't break down for you specifically what percentage of beds are dedicated right now to what respiratory illness. I can say that certainly still the minority of our beds, fortunately, are filled with children who have COVID. That's still higher than we were a few weeks ago. I've said in some other forums that our number of COVID positive patients has tripled in the past few weeks, our inpatients, and it's quadrupled for our outpatients who've tested positive for COVID. We don't do a lot of testing for some of these respiratory viruses when the clinical presentation is very obvious because it doesn't change the care that we're going to deliver. But I think it's safe to say that the minority of beds right now are dedicated to COVID, but that number is on the rise and steeply on the rise. The more children who are not in the hospital that get COVID, and that number has been dramatically increasing over the past few weeks, that will lead to more children who eventually do get hospitalized. And at the same time, we have children, and this gets referred to a lot, we have children who are hospitalized for other reasons, other serious reasons, bone marrow transplants, congenital heart disease, cancer and chemotherapy, and then they happen to be COVID positive. And as you heard somebody mention, you don't want to have to find out what COVID plus RSV is like in a baby. You don't want to have to deal with COVID when you're also dealing with another serious illness in a child. And so there are just so many reasons why we need to be doing everything possible right now to keep kids safe and healthy.
Thank you, doctors. Our next question is from Haley Nelson with ABC6 Columbus.
Thank you for taking my question. Hopefully you can hear me. I'm using a new system today. I'm curious, Dr. Vanderhoff, given the full FDA approval for the Pfizer vaccine, do you expect vaccination rates to go up in Ohio?
Well, I'm really pleased that, as I shared before, as we've looked over the last couple of weeks, we have seen rising vaccination rates here in Ohio compared to when we were looking at much of the depths of July. So I'm indeed optimistic that this announcement will add an additional layer of confidence for some of the folks who may have been on the fence and would hope that we will see more people rolling up their sleeves and getting the vaccine. To me, this announcement by the FDA today was their further affirmation that these vaccines are outstanding, safe, and effective vaccines, and really removes any further excuse for any of us to hesitate on the basis of vaccine safety.
Thank you, Dr. Vanderhoff. Our next question is from Laura Hancock with Cleveland.com.
Hi, I was just wondering, kind of piggybacking on what Jessie was asking, what is the situation with pediatric hospitals in terms of capacity right now? I know that in some states, the RSV situation, such as in Utah, combined with the COVID situation, has made the pediatric hospitals there over capacity. I'm wondering, how close are we to that here in Ohio?
Well, I'll begin by saying that it's watching some of those scenarios play out in other parts of the country and in other parts of the world that has really led us to come here today to share information about, where we sit here in Ohio at this time. I think that the good news is that our pediatric hospitals are reporting to me that while these are troubling increases in the hospitals are pressed by the volumes that they're taking care of, we are not yet at a situation like the ones that we're hearing in some of the states you just referenced. But we could get there. And we want to take every step we can to avoid that. And the good news is that we know what we need to do to help keep Ohio and Ohio's children's hospitals from ending up there. And that is vaccination for those who are eligible and application of the safety measures that have shown themselves to work so well, especially in our schools. And that relates to the masking, the distancing that we were just talking about, as well as good hand hygiene, attention to ventilation, et cetera. So Dr. Manning, what would you add to my answer?
I would add that we are fuller than we usually are this time of year. You've heard a version of that already because of these respiratory viruses that have surfaced at an atypical time. So we're fuller than we usually are, but we're able to handle that. Apologies, my light went out. Hang on a second. We're fuller than we usually are, but we can handle it right now. But two things happen in the fall. One is that when children return to school, our rate of mental health admissions goes up. And so that adds to our volume of patients that we're taking care of on inpatient and our inpatient settings. And the second thing that happens in the fall is as children return to school and people move inside, we see more respiratory viruses. So as Dr. Vanderhoff alluded to, we are sounding the alarm a little bit in advance of that time period, because if we follow the trajectory of some of our southern neighbors, which we don't want to do, but if we do, we could be in a very dangerous position with regards to caring for the children of Ohio. Nobody wants to be an alarmist. I don't want to be an alarmist, but I also feel it's my responsibility to share the trends that we're seeing and to ask for help when we need it. And I feel like it's also our responsibility to just let you know what you can be doing to help us, which Dr. Vanderhoff has outlined so perfectly. So we're good now, but we can't promise you that we'll stay good. And we can't just hope. We talk a lot in medicine about how hope is not a strategy. I hope we don't get there, but I can't just rely on that hope. I have to ask for your help.
Thank you very much. Our final question today is from Kevin.Landers with WBNS 10 TV.
Hello, this is a question for both of you. When do you think we'll reach the peak of Delta in the state? How far away are we from a plateau?
Well, this is Bruce Vanderhoff. What I would say is that in my experience now, having dealt with this virus over many, many, many months, I don't think anyone can make accurate predictions about what the virus will do. However, what I can do is look at the trajectory of our numbers and look at what I'm seeing in other parts of the country and other parts of the world. And what that leads me to conclude is that the Delta-driven wave of COVID-19 will almost certainly be a wave. We will hit a peak of this if it continues to act in the way it's acted in other places. However, I've also seen when I've looked at those other locations that the kind of pattern we're seeing here in Ohio suggests to me that we're not approaching that peak. That what worries me is that we continue to see our numbers escalating day over day. And so I think what we need to do is take that very seriously, recognize that our healthcare infrastructure, while it is coping very well with the demands of the Delta wave now, could be overwhelmed, just as we're seeing in other parts of the country and the world where it has gotten overwhelmed, and that we as Ohioans can and need to take the steps that can help prevent that from happening. And those are the ones that we've been saying over and over here today, begins with vaccination. Clearly, vaccination is our most powerful weapon against this virus and even against the current wave that we're experiencing. But it is supplemented by the other safety measures that we've talked about, masking, distancing, et cetera. So Dr. Manning, what would you add to my answer?
We spend so much time with very talented medical epidemiologists trying to answer that question. We would love to know when this is going to peak. And the reality is we don't know. We just see sort of a fairly steep line up right now based on the volumes that we've already seen. And so to that point, I would just reiterate what Dr. Vanderhoff said. We need to prepare for the worst, hope for the best. We need you to help us. We don't need gifts or donations, but we probably could always use donations, but we don't need pizza or dinners or to be called heroes. And we certainly don't need to be called zeros. We need you to help us by getting vaccinated and staying safe and wearing masks and washing your hands.
Thank you, doctors. That was our final question. Dr. Vanderhoff, if you'd like to share any final remarks, please feel free to do so.
Well, all I'll say is I think Dr. Manning said it very well, and I think she offered us about the best conclusion I could offer. So thank you all very much.